us up front, and then we'll just hop up one right after the other. Becky is going to tell us about efforts from the Johnson City Police Department. Melanie Ryden-Bacon is principal of Topper Academy, Johnson City Schools. Kimberly James is director of Safe Families. Jennifer Berven, director of Inside Alliance. Stacy Seaton, Traces and Values parent, trainer, recruiter from Frontier Health Traces Foster Care. Put that on a name tag. Brandy Maltsburger is behavioral health coordinator with Frontier Health's Building Strong Brains initiative. And then Becky's going to give some highlights, if that wasn't enough, of several of our other partners, just one after the next after the next. And then at the very end, I'm going to give you an update about a faith-based initiative that incorporates this as well. So, Becky, start us off.
Well, being at the police department after working on this system of care and doing a lot of training, it was really my desire to integrate some training into for our officers. But there's not a lot that exists out there. And then again, I have no criminal justice background, and so it's not a a commonly known strategy for officers. So tell you a little bit of background that kind of further strengthened my idea of creating a system of care. When I came to the police department in 2012 from working at ATSU, I was hired to finish writing and then be the director of an $800,000 crime reduction grant. And it was a targeted community crime reduction grant, which the targeted part was, it was based on crime data for the highest areas of town that have the highest drug-related and violent crime, which was our downtown at the time and an older neighborhood called Mountain Home. And the way this grant worked from the Office of Criminal Justice Programs was I had to bring together community partnerships around 4 interventions, one being prevention, one neighborhood restoration, another one law enforcement, and a last one to an intervention to reduce recidivism. And we ended up with 19 programs implemented by 35 community partners, and the partnerships brought in $700,000, actually $712,000 of in-kind on top of my $800,000 grant. We won 2 national awards. 2014, we were one of 5 outstanding criminal justice programs for the year, awarded from the National Criminal Justice Association. When I went to Breckenridge, Colorado to receive that award, some of President Obama's Eric Holder and his staff were there, and the drug czar, and when I accepted the award on behalf of our community, I said, I'm just the band leader, you should meet the band. And that's really been true with what's happened with the system of care, are the resilient, the amazing, the compassionate professionals that we have in our community. So we already had a history at the police department of working together to do things that none of us had already done on our own. Then in 2016, we won the MetLife Foundation Excellence in Civic Engagement Award with a $15,000 prize. And one of the programs that was created under that crime reduction grant was to reduce recidivism. And when I first went to the police department, I didn't even know what recidivism meant. And I told my husband, now I have to fix it. And that's a true story. And within 30 days of me working there, I visited a program in Hendersonville, North Carolina that ended up not what we created, but there I met a national expert on recidivism, Dr. Jennifer Peeler from been at the University of Ohio. Currently she was working for the Council of State Governments in New York, and she was there auditing that program, and there I ran into her on that audit. And she befriended me for several months and explained criminal thinking and taught me how to sound smart to go to the judges and get their buy-in. And then we brought together our community and we created a first probation program of its kind in Tennessee. And at the end of my grant, the Tennessee Department of Corrections, Chief Commissioner Schofield was our commissioner then, Assistant Commissioner Straughter, my husband and I were at Hilton Head, and these commissioners were buzzing up my phone wanting to know about this probation program. I mean, my girlfriends are like, hold the phone, this is too crazy, you know. And but once again, we found this compassion, saw the community saw the barriers to reentry, and so we set out to bring some change. and then the Day Reporting Center was acquired by the Department of Corrections in 2016. So I want you to see, though, that we are working partners. So when we have MOUs together, we're just not in name, but we're sitting around, we're talking about things that none of us are already doing and leveraging some resources, whether it's your office space. I went to Goodwill Industries, I traveled across the state, and I found out that Goodwill Industries oftentimes does second chance job training. And when we created this program, the judges now had created this program that was needing 11 facilitators a week. It's 20 hours, it's a prison diversion. And we created this program that had 11 facilitators, and I only had money to pay for 2. I had a frontier health therapist and a program manager and rent for the building and education. So I went to see Goodwill, our CEO. I said, we need some job skill training. And he said, we have 17 stores, we don't do anything like this, but how about I fund a full-time position, you make it what you want. So I'm here to tell you that professionals everywhere that we are over the top with some of the things that they're willing to think about. And to this day, Goodwill Industries still funds a full-time position for TDOC to do the job skill training. So we were working as partners. So in 2016, Major Steve Smith, he was captain then, and Dr. Greg Wallace from the Johnson City Schools, we'd heard about Andrea and Handle with Care, so she came and made a presentation on a cold February morning, I think, and Andi Clements and I went to it. They're like, it's trauma, you guys come, hear about this trauma stuff. And so the goal was to identify students in the Johnson City Schools who experienced a traumatic incident at home involving police action. So referrals are left to the officer discretion as to what is traumatic. You've heard a lot about violence in the home, and that's certainly something that officers will refer. But one officer, we came and spoke for Karen to Bristol and Kingsport educators and officers, and Officer Willis said, you know, they had a grandmother that died in a home and young children lived there as well, and he deemed that was traumatic, and so sent over a Handle with Care notice. The program is designed to offer support for the student at school by more empathetic responses from staff, on-site access to mental health, counseling, or referrals to outside agencies. So in 2017, we provided a 3-hour training. I was able to train our SRO unit, and they were the first officers to get some trauma-informed policing. And those officers were saying at the end how it would help them go back to work the next day differently, that the problem child, because that's most of the children that they had engaged with. So the problem child, now they could see that problem behaviors can be telling a story of household dysfunction. So in the first school year, we had 53 referrals. We had to train all of our officers on making the referrals and the process. And then the end of last year, the school year, 6 months, we had 51 referrals. So instead of one pilot school where we started it, it's now all across the Johnson City Schools. So we so appreciate their partnership in that. And the school staff like the program because it helps them understand why a student may not be functioning well in class. Also, the students are referred to counseling instead of discipline. You know, sometimes if we realize what our children witnessed at home the night before, instead of being punitive, we might be protective, and thank goodness our educators are getting that. So in the summer of 2017, we did a Handle with Care presentation for the Sullivan County CAC, and shared that with Bristol and Kingsport. So then, you know, it still was on my mind to train officers, and my husband and I, we've raised 2 boys, 27 and 30, and as I worked at ETSU, I trained officers for 6 years. They're not always the easiest group to train. And so, you know, I've done things with my boys before and kind of had that look on their face, like, wrap it up, Mom, you know. And but officers are quite exceptional, and this is not necessarily always a day and age when that's a popular profession. And so we have officers at Johnson City with a heart. And so one thing I knew about training officers, and me not being an officer myself, is that it needed to be information coming from their peers. So when I went to the MARC National Summit, I was connected with some very distinguished law enforcement professionals in Philadelphia, Albany, and Kansas City. So I was able to kind of pick their brains and did a lot of research online. And so during the winter months, I created a 3-hour in-service for officers. It received post-certification in the state of Tennessee, first of its kind in the state of Tennessee. And I've been offering a 90-minute version all summer to our officers, and we're going to kick off the 3-hour version coming up soon. We had already done the in-service schedule for the year, so Chief Turner said, let's just go ahead and don't wait and do a 90-minute version. So 12 Sunday mornings after roll call, which is very early before I teach Sunday school, I've been doing officer training. And the course objectives are to help officers gain a shared understanding of trauma, recognize how trauma affects the brain, to be able to identify trauma on scene, age-appropriate responses. What is an officer to do when an infant's on scene or a toddler? And so we do age-appropriate responses to help them understand about ACEs and the prevalence of trauma. We also talk about examples of trauma-informed policing, which Handle with Care is stellar as far as one. We identify tools to help de-escalate crisis situations. The ICAP, the International Chiefs Association, recommends tactical breathing, so we teach officers. And then we wrap it up by talking about officer self-care, which you've heard about from several. But one thing that are real numbers are officer addiction, suicide rates, alcohol abuse. And so we're teaching officers how to assess through a confidential EAP program that we set up with our HR, where officers are taking away the stigma that an officer needs to debrief. You know, if they are in pursuit, throw out a shoulder, they're on blue shirt, we call it, for 6 weeks till the doctor clears them. There's no stigma with that. There may be a little pain, but no stigma. But there's been too long a stigma that officers have to stuff it in. And one Sunday morning when I finish the training, and I'll be done. I gave you those timesheets, so. Officers asked me afterwards, he said, would you please tell Chief Turner thank you for bringing this up in officer training. And he calls himself our newest old officer. 20 years he was with the Navy doing air reconnaissance for observing submarines. And he was telling me that he had responded to a call where an 18-year-old died on campus at ETSU, and he responded there, and the roommate and different ones quickly got a hold of the family member. So all of a sudden he had this huge family converge, and it was such a grievous, hard scene. And he said, after that, my very next call was a house with a smashed pumpkin, and he said, I wanted to take the other pumpkins and smash them. You know, and all the way in that 10-minute drive from campus to that front porch, I had to regroup and recollect, and so he really appreciated the fact that our department wants to strengthen officer self-care. So we've written a grant that we hope we'll get and partner with Frontier Health to have some additional resources and be able to do some trauma-informed policing of our own.
I am the director of Safe Families, and for those of you who do not know what Safe Families is a respite care for children whose families are having a bout of just issues that can be homelessness, unemployment. Mom needs to go to rehab and she has zero support in the area. Not everyone is fortunate enough, as I have been while raising my 2 kids, to have family members that I can call up in 2 seconds they're there. That's rare, and I'm finding that more and more, that when these moms sometimes are single mothers, they have multiple kids, they have no contact with their families, they have no support in the community. So we are able to provide them that break while giving them resources, and we do that through hostings, and we call those host families. So we have host families, and a host family is a volunteer family. They are not paid. This is a mission that God has put on their hearts, and they want to see that through, and they open their home to however many kids they feel like they can, and they love on them, and they give them a safe place to stay while that family is just getting their life together. We're giving them the chance to do things that they need to do to move forward and to keep that family together. Our main goal is always family reunification. So people always ask me, how do you get referrals? How do those come to you? A lot of times it's DCS. A lot of times I'm getting those calls at 9 o'clock at night. We have a foster family waiting, but this kid, they can't get here until tomorrow night, and this kid's gonna have to stay here overnight, or there's a family out of state and they're gonna come and they're gonna get this child, but we need care for the weekend. I don't want that kid to go to foster care for just 2 nights, and that's re-traumatizing in itself for whatever reason that child's being removed from their guardian. So we're able to call one of those host families up. I send out a text message and I say, here's the need, who can meet my need? And I get texts back. I can do it, we can do it, I can do one night, we can do a night, I can do a week, we can do a week. Our hostings usually last about 27 to 32 days. However, those are very flexible. We do overnight stays, and we just finished up a year-long respite that one of our host families said, we will take this on. A young man from Johnson City, he wanted to graduate and stay in the same school, and we were able to allow him to do that while he was mentored by two of our awesome host families, and he graduated high school. Still keeping contact with his parents. So that's another key thing about Safe Families, is that it's a volunteer program. This is something that when families are in crisis, they can come to us, or they can go to a referring agency, and they're signing their name saying, I'm gonna allow this host family to take care of my child. They can come back and get them at any point. It's very uninvasive. We're there, we're understanding, there's no judgment. We get it, you need a break. What we're seeing a lot of is that these moms in particular are in dire need of rehabilitation from drugs, alcohol, and the only reason they haven't gone to it so far is because they have no one to watch their children. And just because you are suffering from addiction does not mean you do not love your kids. And that is something that we remind ourselves constantly, is that when those moms sign those kids into that host family, they're sad, but they're also relieved because they know that they're gonna be cared for, they're gonna get the help that they need, and they're gonna come out on the other end so much better when they handed those kids over to us for 2 weeks. And we got to love on them, and those kids are gonna have a good time. Their routine really isn't disrupted. They've got a birthday party that next week, that host family's gonna take them to that birthday party next week. You know, sometimes we use the analogy of making sure, whenever we pick up those kids, we're telling them, you know, what's something that you really want to do? Like, we had one little girl, she was like, I've always heard about this place called Dollywood, and I really want to go there. And in my mind, I'm like, oh my gosh, you do not want to go to Dollywood. I went there every weekend when I was little. And she's like, I just really want to go to Dollywood. And we tell that to the host family, you know, but that child doesn't know that we relayed that to them. So maybe in a few days, that host family can say, go to Dollywood? And I mean, their face is like, how did you know? That's all I've ever wanted to do in my 7 years of life, is go to Dollywood. And that's just a small thing that they can offer those kids. That is an opportunity that, like I just mentioned, I clearly took for granted, but that's all that this child wanted. That is a huge perspective. Or having a child say, I really just want to be able to go get some clothes. You know, I just want to be able to do this or that. Or we had one little girl who said, I just really want to go to church one time. I mean, things that we take for granted every day. That little girl is back with her mom, but she still comes to our church all the time. That family goes and picks her up. There's a break for mom for a little while, and that little girl is being spiritually fed for an hour and a half to 2 hours every week. It's that simple, but it's a program that we're still cultivating. So, okay, so talking about trauma response within Safe Families is that all staff have attended this training. So I'm always training our host families. I'm always making sure that they know how to deal with that trauma. And I'm gonna wrap this up, I promise. I might go 1 minute over. So when we were doing that, this is our welcome center. So it doesn't look like a clinic. We're not talking bare walls. We're talking fun. There's a TV in there. There's a movie. They want to watch Finding Dory. It makes me cry every time, but for some reason they want to watch it. So they're able to pick what they want to do while we're doing paperwork with mom, and we're transitioning them to that family that they're going to hang out with for the next few days. And this welcome thing that Becky was a part of this and helping get this welcoming area set up. We found that whenever these kids are going to another family that has children there, this is a completely holistic approach to those children from the host family coming in and automatically befriending these other children that are going to be living with them for who knows how long. It's just normal. They get there with each other, and by the time they leave, they're going home with a friend, and that's exactly what we wanted. So I want to speak on this for just really, really quickly. This is Brianna, and whenever I got to Brianna, she was in the DCS parking lot, and her cousin had just dropped her off because she said, I just don't want to do it anymore. Brianna has a 1-year-old little girl, and it was at the risk of possibly being separated from her. Brianna did absolutely nothing to be separated from her daughter, but it was just part of the system that was coming into play. So I put Brianna into Safe Families, and last night, I did a video with her at our church, and she said, you know, I've always lived with my mama and papa because my mom and dad have always been incarcerated. So she always lived with mama and papa, and then she said my mama died, and then I was with my aunt, and that didn't work, and then I was with my sister, and that didn't work, and then I got with my cousin, and then she took me to DCS. And I said, when did mama die? I'm thinking like 6 or 5, and she said last year. I was like, you have been that many places since you were 16 years old. So we were able to find through Safe Families a home where she is there with her daughter. This family is mentoring to her as a young mother. They're going to parenting classes with her. They're taking her to girls' night out things. They're doing things and they're loving on her daughter. And she is going to finish high school early because of this. They are helping her study. They are showing her how to be financially savvy so that when she's out of this program, she's ready to get into the world. So, sorry, I know I went over.
Hello, I'm Jennifer Berven. I'm the director of Insight Alliance. We are the Substance Abuse Prevention Coalition for Washington County. We have several coalitions in the region, and if you're interested in that, we have a sheet out at our table. And if you don't know about coalitions or you're not a part of your coalition, find out. See me afterwards and find out about how you can be a part of it, because you know, we do a lot of cool stuff. So one of the things we found, one of the first things, you know, coalitions are about prevention. And so when I first heard about this, I was like, well, we don't really do direct services, so I'm not sure how this fits. So we went to the 4-hour, well, we went to the big thing at ETSU that Becky talked about. And we had just started our Lifeline program. And I was like, wow, this is like really makes a lot of sense. I started out in direct service, so you know, I was like, wow, this makes a lot of sense. I can see how this can be helpful. So then we went to the 4-hour training, and then about that time, some information started coming out about the building stronger brains, and for a long time, actually, I thought the two were the same. You know, I was like, oh, it's that ACEs thing, you know. And so still not quite seeing how it fit us. And then, you know, Becky's like, hey, we need trainers. Who wants to be a trainer? And if I probably had $1 for every train the trainer thing in my 20-some years of, you know, doing stuff, well, I couldn't retire on it, but it's a lot. I just cleaned out my garage recently and, you know, found about 20 or so binders of train the trainer programs I've been through. And I'll be honest, this is one of the few over all those years that I've actually gone on to train people with. There's probably been like just a handful. So because it made so much sense, whether it fit into what I did or not, I was like, I need to do this. So then we did the train the trainer, and Becky started the meetings every other month that she talked about. You know, and if I can't make it, I try to get somebody from our agency to make it. So, you know, back to the coalition work and how does it fit, this little flower up here is the strategic prevention framework. It is the heart of coalition work. It is a public health model and how you identify issues in the community. And obviously ours are around substance abuse and how it impacts the community. And so again, how does it impact the community? Well, one of the things that we see in that is ACEs and the, you know, the trauma and what it may, you know, the things that people do to cope with that. And, you know, it's how do you build capacity to do that? How do you find those partnerships? You know, plan to do it, working on a plan. And I was like, well, that's kind of what's happening here. You know, they're building this thing, and so why wouldn't I be a part of it? You know, coalitions bring sectors of the community together. We try to bring folks together, but when we can't bring them together, I always like just go insert myself in other things, because if it helps accomplish what we need to get done, you know, I'll be there. Just tell me when the meeting is. So, you know, part of our thing is, you know, building a healthy community through prevention is our, you know, our vision statement. And so besides preventing substance abuse, you know, one of the things we do is promote healthy and safe behaviors. meaning that if people are doing healthy, constructive things in their community and people are doing positive things, they're gonna have less time and inclination to do those things that might be hurting themselves or their community. We do a lot of community outreach and education. There's just an example of some of our things that we do up here. We have a talk about it, encouraging people to talk about drugs and alcohol and the dangers with their kids. Count it, lock it, drop it, encouraging people to safely store and dispose of medication, encouraging people to quit smoking. Those are just a lot of the things. But in order to do that, we need to reach people. We need to, get to people. And so, part of the, what's in it for me in this is that, by, like I said, going on to do the training, is we do get an opportunity to get in front of people that we may have never gotten the opportunity to be in front of. We also, 5 years ago, we became the host for the region for the Lifeline Program. Again, if you're interested in learning more, I could talk the whole time about that. We got a brochure out at our table, but we got Jason Abernathy here. Jason, if you want to wave. Jason he's somebody with lived experience in recovery, and he works educating folks about addiction, connecting people to treatment and recovery, reducing stigma. And so when he brought that in, it sort of brought into focus again how ACEs kind of fits with what we're doing, because part of doing prevention is helping people understand what the consequences are. And what a better way to understand that. And so, not only can you prevent further trauma, but using the other part of it, the building stronger brains, you can talk to people about, hey, we don't even have to be here. Let's look at the ways we can prevent this from happening in the first place, or how we can be that recharging station or that touchstone for kids. And one of the first times I got to put it into effect was I think it's been almost 2 years ago. We have this thing in the region, it's called the Point in Time Survey, where the regional organization that addresses homeless issues, we go out and we interview the people who are homeless just to get an idea at this point in time on this 24-hour period, how many people are homeless in our region. And so Jason and I were down at the bus station, and I'd never seen this survey before, but it's kind of intrusive. They have you, ask some basic things like, where did you sleep last night, and whatever. And then it asks all these things about, mental health and all these other things. And I was staring at the paper, and I just looked up at this gentleman and I said, what happened to you? And because he was, kind of telling me a few little things and beating around the bush. And I said, well, what happened to you? Remembering my ACEs training, and I was, and he just looked and he just let go. And I don't know if anybody had ever asked him that. So that was like my first aha moment. And that it didn't, directly relate what I do day to day, but when somebody says, well, why should I be interested in this? And my question back is, why wouldn't you be interested? Because whether you use it at work or you just use it in life, when you run into somebody on the grocery store, on the street or somewhere, like I said, and I use that again for the 4 or 5 additional people, and I heard stories, and I spent the rest of the day crying, with them, and I was really able to be present and understand, and hopefully, was able to give them some of that encouragement. Again, going back, Jason's work with Lifeline, how we use it. We also started a thing, the Faith-Based Recovery Network that we have in Northeast Tennessee. It started with a state level thing to get people in the faith community more aware of the substance issues that are hitting the community and affecting the community. The guy who does it at the state level, Monty Burks, he's actually run the numbers, and about half the people in the state identify themselves as a person of faith. And so if you think that you have, if you have the ability to reach half the people through these faith communities, to not only share like the prevention things that we are trying to do with the coalition around drugs and alcohol and opioid abuse and things like that, but to also share with them about the struggles of addiction, It was like a no-brainer. Like, why would you not do that? Why would you not share this? And the ACEs, again, is an important piece because you have people who are now going to be standing up at the pew or in their Sunday school classes saying, hey, I've learned about addiction and what's going on in our community and who needs help with that. And again, we've heard many times, you don't have to be a therapist to be therapeutic, but by arming them too with the ACEs, we can also give them another tool in the toolbox besides resources. We can explain to them, how they can just be present for that person as they direct them towards some solid resources. Again, reducing stigma, improving understanding of treatment and recovery, greater community compassion towards people with addictions, and understanding ACEs. Because prevention is about community level change. That's our biggest thing is we want to create change up here by changing policies and practices, and by getting people to use ACEs both to build stronger brains, but also to provide trauma-informed care. That's the kind of stuff coalitions do. That's what we're about, and that's what we want to do. So again, it's a no-brainer for us. And also, it's a little further on the prevention spectrum, but preventing re-traumatization of individuals so that they are more likely to keep reaching out for help.
Hi, my name is Stacy Seaton, and I work with Frontier Health with the Trace's Foster Care and Adoption Program. But we also have the Safe Place program as a part of what we do. And that program provides temporary housing to youth who have either ran away, they're homeless, or they've been kicked out of their home. And so I really feel like having our foster parents trained in ACEs and trauma-informed care is overflowing into our foster homes and into the lives of our kids. I kind of want to share my aha moment because it's pretty interesting and probably something that not a lot of people would guess. But when I learned about ACEs, it was in the training for trainers, and it really resonated for me on both a professional but then also a personal level. I took the ACEs questionnaire and it was quite high for me, and I was shocked. I was like, wow, I didn't realize I had all of this trauma. And then we did the Paper Tigers screening. And I realized what was different for me than these kids. Why was I able to kind of rise above my circumstances, go to a 4-year college, have healthy, stable relationships with my friends, my family, my husband, and really lead a successful life. And I realized that it was really two things: the grace of God for getting me through those harder years, but then also there were a few caring adults in my life that really invested in me, that looked me in the eye and said, Stacy, I believe in you. Or, hey, I'm gonna do this for you because I know that you can be successful. And what I really feel like is so important is that our foster parents are that one person for that kid. And I think that's such an incredible thing that we get to be a part of. Our foster parents are the people making that change in that kid's life. So I want to share how we've kind of integrated ACEs and trauma-informed care into our program and why it's been so impactful. The first thing that we do when an incoming parent or a parent that's being hired with us wants to begin the training process is that we have them take the ACEs screening themselves. We look at what trauma have you been through in your past. This screening process really does help us better match a parent to a foster child. Our hope is that through that matching process, the parent is going to be able to successfully see that child through from the point where they're placed in their home to their permanency. It also helps us anticipate any triggers. If you've been through certain things, are you going to be able to care for a child who's been through that? Reliving that story. It also addresses the past trauma with our parents so that they can better support our children in times of need. We can also identify, do they need additional training or support themselves? We also did a 6-hour training by Jan McMurray on ACEs Part 2 in October of 2015. And then Becky Haas conducted a 6-hour training for our parents in October of 2017. So collectively, right there, our parents have already had 12 hours of trauma-informed and ACEs training. We additionally did the paper tiger screening with our parents and had an open discussion about the film. We really saw a lot of aha moments in that because our parents were realizing trauma is overflowing into their lives and we can do something about it. It starts within our homes. When that kid comes in and slams his backpack down and says, "I hate school and it's stupid," instead of them saying, "We don't say stupid in this home, go to your room," they're saying, "What happened today at school? What happened? Did something bad happen on the bus? Let's get a snack and talk about it." And then one big thing that I've seen is that the Traces staff continue to further their knowledge and training in ACEs. They elect into these trainings. Even though they've already had 15 to 20 hours, they are continuing to have a thirst for that knowledge. So after doing the ACEs training and paper tiger screening, we saw the foster parents have a lot of insight about trauma, how it affects the brain, development, and relationship building skills. And then the way that ACEs is presented really helps them. I feel like it's in depth, but it's simplified to where you can really understand it and take that knowledge and apply it. And we have seen that within our foster homes, but then also with our case managers that are giving direct care and our therapist that is giving therapy to our kids. And so that's really what we're doing with Traces, and we're really, really proud of Becky, Haas, and Dr. Clements and all that they've done for us.
Is it me or is it hot in here? I'm sweating. Okay. So my name is Brandy Maltsburger, and I am with Frontier Health as well. And for those people that are not aware of what Frontier Health is, we are the largest behavioral health provider in Northeast Tennessee and Southwest Virginia. And I know that sounds great, but we still don't have enough therapists. It's just amazing all of the trauma that people have experienced. I come from a family of 2 addicts. Both of my parents were alcoholics. So I actually score a 5 on the ACEs questionnaire. Is there anybody in here that has never heard of ACEs? So we have a few that have never heard of ACEs. So ACEs is Adverse Childhood Experiences. In a nutshell, it is when there's a questionnaire that kids can take for their ages birth to 18, and it is focused on child maltreatment and family dysfunction. And then there is a score, and there is science and research that backs up and says that the higher your score in ACEs, the higher chance you have of getting physical health problems, mental health problems, and life potential. And I know that's not what my presentation is supposed to be on, so I'm going to just leave it at that. But like I said, my parents were both alcoholics, so growing up in my home, there was a lot of domestic violence that happened in my home. It usually affected me at school that every day in first grade I would call home with a stomach ache. And what kind of got me into this work in this field is that nobody ever asked me what had happened to me. Instead, it was more of, Brandy's calling again, she's sick, she wants to come home, I think she didn't do her homework, or I think she don't want what they have for lunch today. So nobody ever asked me what was going on. I was raised in a family where you were told that what stays in the family, or what goes on in the family stays in the family. And again, nobody ever asked me what was going on. So it kind of brought me to the passion of working with women who are using substances that are pregnant. And I work with ETSU OB-GYN, actually Dr. Martin Olson, who is running for Congress. And that's not a plug, it's just he is. And so he set up this clinic through ETSU OB where he tries to reduce the women off of buprenorphine while they're pregnant and hopefully have them off of their medication prior to their baby being born so that their baby is not born with neonatal abstinence syndrome. Everybody here know what NAS is? Everybody's good? Okay. So, you can see here, we call the program the Cherish Program, or the Mother Child Nurturing Parent Program. We are funded through the Department of Children's Services through their Tennessee Building Strong Brains initiative. And so the Mother Child Nurturing Parent Program provides positive parenting guidelines, access to services that address substance use and mental health needs, and creating a positive impact. The program is designed to assist females either pregnant or who have dependent children and who have a substance use disorder or co-occurring mental health and substance disorder. So as far as the eligibility, it's basically, it doesn't have to be just pregnant women. It's just parents or women or even men that are caring for their child and have dependent children. And so I can do some different things with them, like parenting education. I'm a nurturing parenting facilitator, so I can do parenting classes with them. I try to set them up with counseling. I do meet them where they are. I go to the OB office and I go into, when they have their appointments and they go in for the doctors to check them. After the doctors get finished, then I usually get 5 or 10 minutes with them to talk about ACEs, to talk about parenting, those kinds of things, and just trying to be a support for them. Because as you guys know, there's a lot of stigma that goes with mental health, and there's even more stigma that goes with pregnant women that are using buprenorphine. And so, Frontier Health has an event coming up on September the 15th. It's actually Ice-T is coming to ETSU Mini Dome to talk about some of the things that he's experienced in his life. And so go on Frontier Health website if you want tickets to that. And we have some partnerships or collaborations. Becky has talked several times about the Day Reporting Center or the Community Resource Center. And so I partner with Ashton Belcher, and I go out there and do some parenting education and do some ACEs educational groups with them. I've talked to you about Dr. Olson. I've also, Dr. Sketsina that you saw earlier, she has the Mommies and Me, and sometimes I go out and do some parenting classes for that program. And then the United Way of Greater Kingsport, and I've got on here Becca Sutphin. She's kind of a go-to person for me because she can do anything, is all I can say. Meeting moms where they are, providing them a safe, stable, nurturing environment, and we use evidence-based practices, and I do a lot of educational groups with our inpatient A&D programs. I go out and do educational groups with them about ACEs. And that's it. And I will say I might have to have a higher score on trauma because of the chairs sitting on the edge of this thing. It's very scary. Thank you guys.
I just love this group. All right, we have so many system partners and not a lot of time, so I'm going to talk to you about quickly 5 other partnerships that would have presented today. The ETSU Downtown Day Center is a homeless day center. It's a safe place for individuals to stay during the day. The services include medical, mental health, clinics, counseling, substance abuse, trauma groups, case management, washer dryer. You can give that as your address if you're homeless. Services for showers and laundry. The director and the staff have all been to our SAMHSA trauma training. They were one of the early groups we trained at a large homeless shelter from Knoxville. CARM invited Andi and I to come and train up there, and there were grown men in the room sobbing during one of the videos that shows a trash bag being the laundry, because it really brought new meaning to that being all that individual had. But the frontline staff at the day center are trained to recognize that when they the first person that the guest coming in, they're the first one they see. So staff present an inviting presence by smiling, saying hello, how are you, having a non-defensive stance, showing guests respect, and giving them time and attention to express their needs. Also the signage. Jennifer, the director of that program, is not here today, but immediately, as soon as the training was over, that was something she felt like their signage was a bit shaming and blaming or condescending. When you go, when my boys were growing up, you'd take them somewhere and there'd be those motivational posters, champions are born every day, but you don't think about something like that in a homeless shelter. Why? Because we've limited the people that come through our doors, but not after we saw Healing Need, All right, so they changed the signage. They also have a multidisciplinary team that meets 3 to 4 times a week, and some of the guests they serve get on case management, and so what they've started doing now is using the ACE score, the ACE test, and they use that when the individual takes the ACE, then they use that to help guide the treatment plan from the multidisciplinary team. Then we have 180 Health Partners, which is a health organization that does home visits with pregnant mothers struggling with addiction, the year the mother's pregnant, as well as the first year of the child's life. Actually, Stacy, who's our local coordinates that program. She originally was our trauma-informed care staff person at the Boys and Girls Club. So you kind of see how our web is wove together. Now Brandy's doing groups for Karen, and and so that's another benefit of our system of care meeting is now we have resources in the room that can help one another. But they do trauma-informed training for all their staff. Their team members implement trauma principles when working with the mothers, and they're working to change the culture of this new company to be trauma-informed. Also, King University, Dr. Jody Helbert, she was instrumental in the Department of Social Work starting at King University. I met her through a screening she did of self-care for first responders, but her goal is to make King University a trauma-informed campus. So far she has hosted lunch and learns on campus, and she's visited all their auxiliary campuses and done some trainings. And then she's anticipating doing some training for the Department of Education there this year. In 2017 is when she hosted the self-care event and showed the film I mentioned earlier, and had Vic Comfer, the filmmaker, was there with it. And they had about 75 first responders from the area that came out that night to watch it. And also right now, as we are doing this forum, she is in Trinidad, where she was invited by the Ministry of Education to see if there could be a connection between some of their disparities there and understanding trauma. And she's also offering trauma-informed care as the Bristol area. Margaret Firerobin, the mayor of Bristol, she's been a real champion in this ever since she came to the training. Our Vice Mayor Brock, she's come to the training. Then Margaret, I've gone over and spoken for a couple of groups over there, and just a few weeks ago we kind of launched the system of care in Bristol, and so right away we had Jody Helbert, who's in King University, and Karen, who's in Sullivan County, are going to do their trainings. And so see, that's how this thing begins to grow, all right? All right, then we got the Holson River Regional Library. Nancy, you still here? Nancy Rourke, okay. Nancy works for Secretary Trey Hargett's office, and she is a regional library. Who knew libraries could be like this, So much fun. But sometimes the librarians know that at night when they're ready to turn out the lights, there's this teenager or a young mother over in a corner, because that's the safest place that woman can go, or that teenager can go. So the library's in the Holston region and covers 10 counties, quite a few libraries, I think 21. And we've held a region-wide training for the library staff. Now, if you've ever seen the movie Removed, there's a little scene where the foster mother is reading a book to the little traumatized girl, and she tears a page out of it. Oh my gosh, you should hear librarians. They gasp at that little book tearing page. That was traumatic in our training for them. And then now they're looking at assessing policies and procedures. And one of the examples that Nancy gave me was that they don't require a library card to use the public computers. Hello, you might be homeless. You may have no address. And a library, okay, so in the summer of 2017, our local Johnson City Public Library, they hosted a paper screenings tiger. All the staff's been trauma-informed. The staff is developing skills on how to approach people gently, learning proper gestures and a low tone of voice, and talking to people in a different way with respect and understanding sometimes why people come into libraries. Also, they're purchasing books to have a trauma-informed section in their library. And then they're realizing that there's so many disadvantaged patrons that come in. Staff maintain a current list in order to make referrals for housing and meals and those kinds of programs. Also, Washington County Health Department, many of the staff have come through training. The key staff have also have come back for Train the Trainer. They've attended our system of care meeting. They're working on a strategic plan underway to launch a home visiting program in the summer of 2019. And as they're ramping up for that, they're doing trauma-informed concepts are being worked into the program planning. And design has expectation that all the home visitors will have trauma-informed care training before the home visits begin. So with a trauma-responsive approach, the hopes are that these home visitors will have a better reception and an understanding of the role that trauma plays in the family, disparities specifically with the children, and the intent is to have a warmer, softer home visit than maybe what some of these families traditionally have been used to. So by utilizing trauma-informed care, we'll better transition situations where family may be involved with DCS or had negative experiences in the past.
Okay, I am not going to show you all my brilliant slides that I have for this. I am an actual partner now. I'm not the person leading this. This is just one of the things, one of the many endeavors that we're doing. And I mentioned earlier that my goal is to solve addiction. And I thought, well, we're going to need an army for that. And so a couple of years ago, I had said, well, what if we mobilize the church to do this? Well, then lo and behold, a while later, we got asked to lunch by a fellow that we did not even know. We'd met him, but part of a focus group before that. And he said, I'm thinking about mobilizing the church to address addiction. And, well, I'll raise all the funds and y'all just decide what we're going to teach. And I said, okay. So anyway, long story short, in May we had a summit that brought in, it's in partnership with Duke University, and we had speakers from really all over the world in Bloodville here, just a few miles from here. And about 450 people attended. It was for clinicians and clergy and church members and interested community members or whoever. And so about 450 people came to that. We had a follow-up meeting in July, and we had 79 people representing like 35 churches or something like that. They're just saying, tell me what to do, tell me what to do. And so I have the brilliant slides here that basically overlay trauma-informed principles with biblical mandates. And so people say, well, yeah, but that's not really church work. Well, yeah, it really is. And so they so beautifully overlay that helps sell it to church folk. But even churches are not always so good at dealing with those people, you know, those people, well, we'll give them some bread or we'll send some money or whatever. And so what we now have some trauma-informed training specifically for churches that I've done we've done a couple for faith-based groups, and then we're going to do a large one this fall. But to help a lot of people that want to do good and want to help and want to help people out of where they are, but really don't have the tools to begin using some of these concepts. And so I wanted to present this mainly to say that doors just keep opening and opening and opening and opening. And so whatever your segment is, I think there are probably some doors that can be opened where you can use this. So it may be your garden club. I don't know what a garden club is, but it may be, I don't garden. But just to say that it fits wherever there are humans, if you are a human. And so, but this has been really exciting to work with, and that is what takes a lot of my passion right now, because it's really addressing the thing that I most want to see the change in our region. So.
Mary's slide here, and then real pleasure of mine to introduce Tennessee's First Lady, which, oh dear, security alert, which you know Ms. Haslam sure has plenty to do, and I know there are people in Tennessee that will be a lot better at summing up the legacy of Governor and Ms. Haslam at the end of their tenure, but just my own life, the program that Governor Haslam got started with the Family Justice Center, that's how I first heard about trauma-informed care. Also their involvement with Safe Families that we were able to help launch up here. Also a reading program that Ms. Haslam does that we initiated at the police department, Read 20 Book Patrol, as well as their statewide trauma Building Strong Brain program. So without further ado, let's welcome Christy Haslam to the stage.
Becky. Oh, thank you, Andi. I tell you what, y'all talked about cloning yourselves. I'm all for it. I want to clone. I thought we could just clone you like 95 times and put you in every county in Tennessee. We'd be really thankful. So keep working on that process. And thank you also to all the partner panelists who've talked today, all the speakers who have been a part of this. I have learned some new things that I'm taken back and excited about, and just love to hear what's going on here in Johnson City. Thank you for coming. Thank all of you who are here for coming. How many of you are not from Tennessee? Oh my goodness, that's awesome. How many of you are not from Johnson City? Lots of you. Oh, this is wonderful. Well, what a wonderful, wonderful day we've had. And it's not over yet. It's not over yet. There's another wonderful speaker coming. Not me, after me. You know, you've heard from the experts, but I'm in no way an expert or anywhere near have the experience that they do in executing systems of care, but I do know that this is important. This matters. As I think Becky said, it's like we found the cure to cancer and we've got to tell everybody. I also have had the privilege of observing from a bird's eye view what's been going on all across the state of Tennessee for the last few years. And so that's been exciting to watch. We're so proud of Johnson City, and I think this is really going to be a model for the rest of Tennessee and hopefully for other cities and other states. And from the beginning of my husband's first term as governor, he said he wanted to focus on making Tennessee the best place to live and work and raise a family. And I think all governors say that, don't they? Anyway, but his priorities really broke down into working on education, K-12 education and higher education, and working on bringing jobs to Tennessee, better jobs for our educated, hopefully, workforce, and efficient and effective government. And they may not seem connected, but you know they are. A strong economy builds a skilled workforce, and a skilled workforce begins with healthy, educated children who are able to succeed because they've been nurtured and supported. And in fact, one of the reasons I chose early literacy to work on and parent engagement as my focus as First Lady was that I knew that education was a great gateway to a successful life, and I wanted that for our young children, and we are very far behind, but we're getting better, and that's the good news. We have more to do, but we're getting better. But you look at all that, and when I first became First Lady, I had lots of people come and tell me, why don't you work on this, and why don't you work on that? And there's so many different issues that you can work on as a First Lady or First Gentleman. But we know that if our children are stressed and distracted, then they're not going to get the full benefits of school and of learning. And in fact, their brains won't allow them to. They won't be wired to allow it. And when I heard about ACEs and I heard about trauma-informed care, I thought, this could help every one of these problems that have been brought to me that people are saying we need to work on. So over the past several years, we've come to know more about ACEs and their effects and how to build resiliency. I first heard about this in Memphis, actually. And I was invited to a meeting in Memphis and came to that meeting, and they had every important leader of the community in a room.